I wonder if Dr. Duane Kirksey, if you want to pick up on the medical side of this.
I would like just, to impress upon the importance of what Dr. Ehman had mentioned, that, if you don't want this person to make decisions, you should have an advance directive. The situations that tend to come up most often are people that are separated but not legally divorced, and for same-sex couples, where you want your partner to make decisions for you. For reasons unbeknownst to me, oftentimes when people are near their death, people tend to come out of the woodwork that you may not have, known before. And I've seen situations of people that were not legally divorced. These, separated spouses have come from, far reaches of the earth, and this previously separated spouse and this partner that you've had for the last 20 years, are debating the merits of what to do in these cases. In terms of the medical aspects, it's important to have these advance directives before the situation comes up. Oftentimes when people are, in these very dire situations, emotions run high, and it's very difficult to make these decisions, at these split-second, what seems like split-second instances. Physicians tend to be, are very comfortable with seeing people live, very comfortable with seeing people die, and we often make the assumption that if somebody comes in critically ill with something as pneumonia and goes from, their functional state to being, critically ill within hours, to face a family with the decision of what should we do. And oftentimes we don't, the family doesn't know, and it's hard in such a short time to grasp the fact that, days ago, my loved one was completely, capable. They were walking around. They just went to the store yesterday, and now you're telling me this person has a critical illness, and they could potentially die within hours. And now I want you to make a decision about whether to, do IVs, antibiotics, whether they should be resuscitated. And for us, it seems like a routine decision. We do it all the time. But for the family to go from, the person that they knew, potentially maybe a day ago, to the person that they see in front of them, it takes a little bit of time just to digest that. That being said, in terms of all the medical decisions, they are very difficult. Resuscitation, in particular, is one of those things that it's hard to really say, what the success rates are. Well, actually, the success rates are actually relatively known. So in general, if resuscitation is done perfectly, more often than not, between 1/3 and 10% of people will go back to their pre-morbid state. The question is not necessarily what happens if they go back, but what are the other options? One option is potentially that they don't live. The other option is that they may live, but come back in a state that they wouldn't be happy with. Oftentimes when we present this information, it's not always as we say, fair and balanced. And physicians do oftentimes have a sense of the patient, and based off of their experience and based off of how they see situations similar to that go in the past, they may present information one way or the other. And physicians have ageism and diseaseism as well, and physicians in general, we're trained to save lives. We're trained to keep people going. If a young person comes in their 20s and 30s, we'll try our hardest to try to get them to go through, because we know that they have all these years left. If somebody is in their 90s or older with multiple medical problems, we'll still try as hard as we can. But oftentimes, those are the situations where we try to come to the family and say, do you really want to do this? And I think it's much better in a calm situation to do these things, when you're not faced, with all the stress of being in a hospital, of having people coming to you and saying, we need a decision, now, or we're trying to, press you to figure out what exactly to do.
Thank you. Yeah, Shari, do you want to add to
I
that?
have one other thing I wanted to add, which is when patients' rights became a conversation that was being held nationally, there was a statute enacted that requires every a hospital or institution in Pennsylvania to ask you when you're admitted if you have a living will or if you want one. That's a wonderful thing, especially given the announcement today that they're going to try and make sure that the hospitals are actually following them. But that's a terrible time to be filling it out.
That's right.
So when you're already in some kind of trauma and you have to make those decisions, you're not thinking the way you should be thinking when you make these decisions. So it's very important to do it in advance before you're in a situation where you really can't make those decisions.
Gail?
I just quickly want to add to that because I think that was an excellent point and I was trying to jump in on, and I appreciate that. Even more so recently. Death is the veloma that we will not speak about in America. We won't speak about right now while we're sitting here in this room, or even though we're talking about it, we're really not talking about it because part of that would be experientially thinking about and trying to put ourselves in that place. What does this mean if I got to this point? Our advanced directive system is great, but at the same time it's very confusing. Most people, when they answer the questions, are answering them as if they're healthy and how they're feeling today, not feeling debilitated or sick, or have been in and out of the hospital several times. And I think the point of doing it in the hospital is also an excellent point because now you're under stress. Now you're making a decision either for yourself or your loved one. Not that I'm going to compare a person to a dog, though I may. I just recently lost 2 dogs. I put 2 down, never had to do that my whole life. The second dog I loved more than anything. I had him for 9 years. He was totally blind. I rescued him in North Philly. But the hardest part of that was for every day that I was running up a hospital bill for over $2,000 a day. I'm really crazy. A doctor would come in and sort of say, well, I really wouldn't give up on him yet. And we kept on going another day and another day with a little bit of hope that this was going to be the right thing for him. And then a Sunday morning, a doctor came in and totally approached it from a different way and looked at me and said, how does he look to you today? And I knew where she was going with the conversation. And I finally made a decision to let him go, which was the hardest thing I ever had to do. I see people go through that because I take care of children and adults, and parents are always put in that awful position of feeling guilty for making a decision to not want to continue with their child for aggressive treatments. And usually it's the child who tells the parent that I'm ready, I don't want to do this anymore. Well, we see that too with 90-year-olds, 80-year-olds, 20-year-olds. It really doesn't matter. And if you could do your family a favor today, when you leave here, just take a few moments to reflect on what you would want at end of life. Because you know what? None of us have a guarantee. Tomorrow we could wake up and not be here, or we could be sitting in some emergency room. And it is an awful position. If you don't do it for anyone else, do it for your family, if you like them, by the way. Let's put the qualification on that. I have never seen worse pain when a family had to make a decision and they didn't even know that they had an advance directive. There was a woman in a local hospital around here about 2 years ago. One of the family members came to me and asked the question, does she have an advance directive? Because she had ALS. That's Lou Gehrig's disease, where she couldn't speak for herself, and she was in the ER, and they wound up intubating her. And I said, does she have an advance directive? And they said, we don't know. So they searched her house and found it, and they were able to eventually take her off the ventilator, which was something she didn't want. But that could happen to any one of you in this room, including myself. So that's my piece, that you really want to reflect on that and not make that. It's like arranging for a funeral home after you've died. A lot of guilt comes into play there, and you wind up spending way too much money.